Imagine this for a moment. It's late, the house is quiet. You switch off the light, pick up your phone, and you open that private tab you'd never want anyone to see. You tell yourself it's harmless, just a bit of excitement, a little escape before sleep. Your heart starts beating faster, your breathing changes, and then you notice something you weren't expecting, a tight squeezing feeling in your chest. Not pain exactly, more like pressure. You pause, you swallow, you wait for it to pass, and for a split second you wonder, is my heart actually struggling right now? Stay with me because in this video I'm going to explain, plainly and calmly, how sexual excitement, with or without pornography, can create a surge in blood pressure and heart workload after 60. Why that matters if your arteries are stiff or narrowed, and the specific warning signs you should never brush off as just getting older. And later on, I'll give you a simple, practical safety plan you can start today. No gimmicks, no panic, just sensible steps. Before we go further, a quick safety note, because I take this seriously. If you ever have sudden chest pressure, pain spreading to your jaw or arm, severe shortness of breath, fainting, or sudden weakness on one side of the body, don't try to ride it out. Seek emergency help immediately. Now, with that said, welcome to BravHealth, where we talk about real health risks in a clear, practical way, without medical jargon or fear-mongering. And if you're over 60, do me a favor, like the video, subscribe, and leave a quick comment with your age range, 60s, 70s, or 80s, because it helps me tailor the next videos to you. Now, here's the first hook that most people don't expect. This isn't really about pornography. It's about what happens inside your cardiovascular system, your heart and blood vessels, during sudden arousal. And in a moment, I'll show you the one silent sign that often appears at night, long before anyone gets a diagnosis. Let's clear up the biggest myth straight away. Pornography is not a chemical toxin that automatically destroys arteries. The more accurate and far more useful truth is this: sexual arousal can act like a mini stress test. It increases your heart rate and blood pressure for a short period. If your cardiovascular system is healthy and stable, that spike is usually handled just fine. But if you already have risk factors, high blood pressure, diabetes, plaque in the arteries, or a history of angina meaning chest discomfort caused by reduced blood flow to the heart, then that sudden surge can sometimes reveal a problem you didn't know was there. Does that make sense? It's not the screen, it's the surge. And here's a quick question. Have you ever felt your heart pounding unusually hard during excitement, even when you were just lying down? Hold that thought, because the why matters more than the headline. Now let's talk about what's actually happening in your body in simple terms. When you become sexually aroused, your nervous system shifts into a higher gear. This is largely driven by the sympathetic nervous system, basically the fight-or-flight arm of your body that increases alertness, heart rate, and blood pressure. Your body releases adrenaline-like chemicals called catecholamines. Think of them as the body's go signals. That's useful when you need energy and arousal, but it also raises demand on the heart. Your heart must pump harder and faster, and your arteries have to stretch and respond smoothly. Here's the micro hook. After 60, that stretching part is often where the trouble begins, and in a moment I'll explain why stiff arteries change the entire equation. So why does age matter so much? One of the biggest changes after 60 is arterial stiffness. Arterial stiffness means your arteries are less elastic, less able to expand with each heartbeat. When arteries are flexible, the pressure wave from your heart is absorbed gently. When arteries are stiff, the pressure wave bounces back more strongly, and the heart has to work harder. Over time, stiffness often travels with atherosclerosis. Atherosclerosis meaning plaque buildup inside artery walls, like a slow narrowing that can reduce blood flow. Now you might be thinking, but I don't feel anything day to day. Exactly. That's why this topic matters. Many artery problems are silent until your body is pushed into a demand spike, like sudden stress, rushing upstairs, or sexual arousal. And here's a pattern interrupt to keep it real. I once spoke with a 72-year-old viewer who thought he was perfectly fine because he didn't get chest pain while sitting around. But he noticed he felt oddly breathless during intimate moments, even without much physical movement. That was his clue to finally check his blood pressure properly and speak with his doctor. The point isn't fear, it's awareness. Now here's another one that might surprise you. It's not just old age. It's often the combination of hidden blood pressure and stiff vessels. Let's get practical. Who is most at risk when these surges happen? If you're over 60 and you have any of these, you should pay closer attention. 1. Uncontrolled hypertension. Hypertension meaning high blood pressure that stays elevated over time. 2. Diabetes or pre-diabetes. Pre-diabetes meaning blood sugar levels higher than normal but not yet in the diabetic range. It still damages blood vessels over years. 3. Known heart disease, stents, prior heart attack, or stroke. 4. Chest discomfort with exertion, even mild exertion like walking uphill. 5. Smoking history. And 6. Sedentary lifestyle, meaning you don't regularly do light exercise, because your body becomes less efficient at handling sudden bursts. And here's a quick, do this with me now check. Place 2 fingers on the side of your neck or your wrist and feel your pulse. Is it calm and steady? Now imagine it jumping quickly without you moving much. That's the type of spike we're discussing. In a moment, I'll give you a simple way to recognize when a spike is normal and when it's a warning. Now, an important nuance, because this channel is about being trustworthy. Sexual activity, even in people with heart disease, is often safe when the condition is stable and managed. The danger zone tends to be when people have warning signs and ignore them, or when blood pressure is uncontrolled, or when medications and substances create risky combinations. And that brings us to a key topic many channels avoid: the stacking problem. Porn is often consumed late at night, sometimes with alcohol, sometimes with poor sleep, sometimes with dehydration, sometimes with anxiety, and sometimes with erectile dysfunction medications. Each of those can affect heart rate and blood pressure. Alcohol can lower blood pressure at first, but worsen sleep and trigger palpitations in some people. Poor sleep raises baseline stress hormones, making spikes more dramatic. Dehydration can make your heart beat faster to maintain circulation. Anxiety can drive the sympathetic response even higher. So ask yourself, is it really just arousal, or is it arousal plus 4 hidden amplifiers? Stay with me, because next, I'm going to give you the warning signs that matter most, and one of them is something people mislabel as indigestion all the time. Let's go through the warning signs in a calm, sensible way. First warning sign: chest pressure, tightness, or burning that appears during arousal or sexual activity, and especially if it eases when you stop. This can be angina. Again, that's reduced blood flow to the heart muscle. Some people feel it in the chest, some feel it in the throat, jaw, upper back, or left arm. Here's the key question. Have you ever paused and thought, that felt wrong, even if it wasn't dramatic? If yes, don't dismiss it. Practical step: note when it happens, what you are doing, and how long it lasts, and discuss it with your clinician. And if it's severe, sudden, or associated with sweating, nausea, or breathlessness, treat it as urgent. Now here's another one that might surprise you. Many people don't get pain, they get breathlessness. Second warning sign: unusual shortness of breath, especially if you are not moving much. Breathlessness can be a sign the heart is struggling to meet oxygen demand. It can also relate to lung issues, anemia. Anemia meaning low red blood cells that carry oxygen, or simply being out of condition. But during a surge, if you're suddenly puffed, that's information worth respecting. A practical takeaway: if breathlessness appears out of proportion, stop, sit, slow your breathing, and don't push through as if it's a test of toughness. Then book a medical review if it repeats. But wait, this next one is even more interesting because it can be mistaken for just nerves. Third warning sign: palpitations. Palpitations meaning you can feel your heart pounding, fluttering, skipping, or racing. Everyone can get palpitations occasionally, but if you notice them during arousal or you feel lightheaded with them, it could suggest an arrhythmia. Arrhythmia meaning an abnormal heart rhythm. Some arrhythmias are benign, others need evaluation, especially if you have risk factors. Practical step. If it happens, check your pulse. Does it feel regular like a drum or irregular like it's tripping? You can also use a home blood pressure monitor that shows pulse. And here's a micro hook. In a moment, I'll tell you the one home number that matters more than people realize for preventing these episodes. Fourth warning sign: dizziness, nausea, or feeling faint. That can happen if blood pressure swings quickly or if the rhythm becomes irregular. It can also happen with anxiety, but again, don't assume. A safe, practical action. If you feel dizzy, stop activity, sit, and hydrate. If it's recurrent, you need a review of blood pressure, medications, and heart rhythm. Now, a quick myth buster. If I can still function, it can't be serious. That's not true. Many serious cardiovascular issues begin with mild, brushed-off symptoms. And here's another one that might surprise you. The most overlooked risk isn't the moment of arousal. It's what your baseline is every other hour of the day. So let's talk about the baseline that predicts how risky a surge will be. Your blood pressure and your fitness level. Blood pressure has two numbers, systolic and diastolic. Systolic is the top number, the pressure when your heart pumps. Diastolic is the bottom number, the pressure when your heart relaxes between beats. If your baseline pressure is high, then a surge pushes you into a higher range, and stiff arteries tolerate that poorly. Here's a practical, no-drama plan. For the next 7 days, measure your blood pressure at the same times, morning and evening, seated, relaxed, feet on the floor, arms supported. Don't do it right after coffee or after walking about. Write it down. Ask yourself, do I actually know my baseline, or am I guessing? Because guessing is what keeps problems silent. And here's the hook. In a few minutes, I'll show you how to turn those readings into a simple green, yellow, red system so you know when you're likely safe and when you need medical guidance. Now we need to address a sensitive but important part: erectile dysfunction medicines, if you or your partner uses them. I'm not here to shame anyone. This is about safety. These medicines are called PDE5 inhibitors. PDE5 inhibitors, meaning drugs that help blood vessels relax to improve erections. The critical warning is about nitrates. Nitrates meaning chest pain medicines like nitroglycerin used for angina. Combining PDE5 inhibitors with nitrates can cause a dangerous drop in blood pressure. If you use any medication for chest pain or you've been prescribed nitrates, you must discuss sexual activity and ED medicines with your doctor. I know that conversation feels awkward, but it's far less awkward than an ambulance. Now here's another one that might surprise you. You can improve your safety without giving up intimacy or living in fear. So what should your viewer actually do, starting tonight, without spiraling into anxiety? Here are practical steps, explained like we're sitting in your living room. Step 1. Don't treat warning signs as embarrassing. Treat them as data. If chest pressure, unusual breathlessness, or dizziness appears during arousal or sex, that's a reason to evaluate your cardiovascular status. Step 2. Build a calmer ramp, not a sudden spike. Sudden surges are harder on stiff arteries. That means avoiding stacking triggers: late-night pornography after heavy alcohol, a large meal, dehydration, and stress. Ask yourself, could I separate these and make the surge gentler? Step 3. Improve your surge capacity with regular movement. Regular walking, light strength work, and simple leg exercises improve circulation and reduce the heart's workload during bursts. This is one reason why people who are regularly active are less likely to have a problem during sudden exertion. And here's your micro hook. The next part is a short, safe routine that takes under 6 minutes and directly supports circulation. Do this routine daily for the next 2 weeks. Sit to stands from a chair for 1 minute at a comfortable pace. This trains your legs to handle blood flow demands. Heel raises for 1 minute. Your calf muscles act like a pump to push blood back to the heart. Marching in place for 1 minute. Gentle but effective. Shoulder rolls and arm swings for 1 minute. This helps circulation and breathing rhythm. Then 2 minutes of slow walking around the room with nasal breathing. Nasal breathing, meaning breathing through your nose, which tends to keep the nervous system calmer. Ask yourself, could you do that every day? If the answer is yes, you're already building safety. Now here's another one that might surprise you. The goal isn't just stronger muscles. It's more flexible arteries and steadier pressure. Let's do a quick micro recap, because this topic is easy to misunderstand. Porn isn't a poison. The key mechanism is the surge in heart rate and blood pressure during arousal, especially when combined with stiff arteries, uncontrolled blood pressure, and other stressors. The body can handle surges better when baseline health is stable. So we focus on baseline, warning signs, and sensible steps. And now, as promised, here's a simple green-yellow-red safety mindset you can use. Green. You have stable, controlled blood pressure. You can walk briskly or climb 2 flights of stairs without chest discomfort or unusual breathlessness. And you don't get palpitations or dizziness with mild exertion. Yellow. You often feel breathless with small efforts. You have uncontrolled blood pressure. You've had chest pressure before, or you notice palpitations. Red. You have known unstable heart disease, recent chest pain, recent heart event, severe breathlessness, fainting, or major symptoms. This is where you need medical guidance before treating sex like business as usual. This is not about judgment. It's about being smart. Now, but wait. This next part is even more useful because it gives you a script for how to speak to a doctor without embarrassment. If you're in the yellow or red zone, here's what you say, simply, I've noticed chest pressure or unusual breathlessness during sexual arousal or activity. I'm concerned about my heart and circulation. Can we assess my cardiovascular risk and blood pressure control, and is sexual activity safe for me? That's it. You don't need to mention pornography if you don't want to. The medical point is the surge and the symptoms. You may be offered basic testing, a medication review, and advice based on your fitness and risk profile. And here's another pattern interrupt. I've seen people delay this conversation for years out of embarrassment, only to discover their blood pressure was much higher than they believed. That's a fixable problem. Silence is the dangerous part, not the question. Now let's circle back to the scenario we started with, the late-night private habit. If you ever feel that chest tightness again, your next steps are simple. Stop, sit up, slow your breathing, and don't prove anything to yourself. If symptoms are severe or don't settle quickly, seek urgent help. If it happens repeatedly, get assessed. And in the meantime, reduce the stacking triggers. Don't combine arousal with heavy alcohol, huge meals, dehydration, and sleep deprivation. A practical tip that many people find helpful is to shift intimacy earlier in the day when the body is less strained, and to keep arousal gradual, not abrupt. And here's the hook. In the final minute, I'm going to give you a clear checklist of what to watch for and what to do next, so you can leave this video feeling calm, not scared. So here's your takeaway, warm and simple. After 60, sexual excitement, whether from pornography or real-life intimacy, can create a short-lived spike in heart workload. For many people, it's perfectly safe. But if you have stiff arteries, uncontrolled blood pressure, diabetes, or hidden heart disease, that spike can expose warning signs like chest pressure, breathlessness, palpitations, or dizziness. The smartest move isn't avoidance, it's awareness, baseline control, and getting checked if symptoms appear. And if you want one simple action starting today, measure your blood pressure consistently for a week and begin the 6-minute circulation routine daily. Small habits done consistently protect you far more than panic ever will. If you found this video helpful, like it, subscribe to BravHealth, and comment one word, green, yellow, or red, based on how you honestly feel your risk sits right now. And in the next BravHealth video, I'll cover over 60, the 4 healthy foods that quietly stiffen your arteries, and the better swaps, because most people aren't harmed by obvious junk. They're harmed by everyday choices that seem harmless for years. Stay healthy, and I'll see you in the next BravHealth video.